we can use, but if at all it is voluntary, it will be better. But how will you fix it?
More like I was thinking of a small cylindrical thing that I can roll inside my tongue to give me stability to hold it like this.
I guess it won't be because you have to do with the there, no? How will you hold the tongue at in particular place?
Tongue ಒಳಗಡೆ
ಒಳಗಡೆ.
ನೀವು ಒಂದು ಬಾಲ್ ಅವ್ರ ಸಿಲಿಂಡರ್ ತರದ ಏನಾದ್ರು ಹೋಲ್ಡ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಆ ಹೋಲ್ಡ್ ಮಾಡೋ ಇದ್ರಲ್ಲಿ ಒಂದು ಸ್ಟೆಬಿಲಿಟಿ ಸಿಗ್ಬೋದಾ ಅಂತ ಆ ತರದ ಏನಾದ್ರು ಯೂಸ್ ಮಾಡ್ಬೋದಾ?
I think it won't be because sometimes patient will take out the jiva. It is danger again. It will go inside or not. It might get stuck. In rare cases, I'm telling, not better to do like that only. If not, do this. If not, but this results will come bit late. Exact is adhojiva is in between the frenulum and frenular artery.
So just to honest question. Unna, the actual classical reference that we hear is Unnamita Vidashta Jihva Grasya Adha. So Jihva Grasya Adha. So Jihva Gra means
Adaha.
So Unnamita. Vidashta. Vidashta means the one is Jihva Grasya Adha. So
Jihva agra should be done Unnamita. Adha.
So my question was, how exactly are we trying to understand the frenulum out of this reference?
So the thing is, see, when you take it, the what you say, tip of the tongue on the hard palate. The thing is, there what is adho? That point we should take. Adho jiva is there, not like this. If we do like this, it won't come. And wherever usually where we do is with the like with the karma or sira whether is wherever there is a huge supply of blood. So in tongue also, when we say anatomical, it is near the frenulum. Yes.
So why are we not pricking the sira itself?
That is artery. It's not a sira. It is dhamani. It might bleed more. Yes. So this is Nasa Roga. So in Gandha Agrahana and all kinds of Nasa Roga. Pinch the tip, then insert the needle as the break. Clear now? Next. Huh? Huh? No, not for Upanasika. Next. Hanu Viddha, where I had told the Adam's apple. See, sir is palpating Adam's apple. See. Just above the Adam's apple, we are pricking. Ardhavre. While pricking, the needle is going perpendicularly. Later it is falling, that is the another issue. But while pricking, it should go perpendicular to the skin. That we had learned last class. Again, I am repeating. Perpendicular to the skin. Next. Karna Vidya. Karna Roga. For any kind of Karna Roga. See, Karnayor Upari Samanta. and below the Vidura marma. See, there is a Rakta Srava from above. Yes? Understood? Yes, this is Vidura marma. ಒಂದು ನಿಮಿಷ ಸ್ವಲ್ಪ ಹಿಂದೆ ಹೋಗ್ಬೋದಾ? Next. This is Vidura marma. Just Ardha Anguli below the Vidura marma. Mastered process. Yes? I'll be showing it on the person also. Okay? Next. So till here we had finished. Now comes the very much more awaited with. So see, all in Indralupta, Arumshika and Darunaka, they have told to do Sira Vedana on the scalp. But where on the scalp? Where on the scalp? So here comes modern anatomy to save us. Because see, these are the 6 points, 3 on each side, where there is more of anastomosis in the scalp circulation. There is more of anastomosis over there. So these 3 points you have to take. 6 points, 3 points on each side. How to calculate these 3 points? Everyone knows Shikha. Tenari Ram's Shikha. Where it starts is here. Yes, exactly in the middle. Here. So 2 angulis front. 2 angulis of that particular patient. 2 angulis front and 2 angulis on either side. So if you draw one line like this, so these are 2 angulis apart, and even 2 angulis in between also. So it is a game of 2 angulis only. From Shikha, you should go front. Yes, from Shikha, 2 angulis front, this line will come. So this is Shikha. Suppose my 4 angulis, this is 2 angulis. So this line will come. So on this line, where again? So from midline, 2 angulis. Understood? So 2 angulis, then 2 angulis front, 2 angulis front. This is one. This is usually used in hair fall and Darunaka, even in Arumshika, but not in Indralupta. Indralupta, wherever there is loss of hair, there only we will do Prachana Karma. We will just go on pricking it. Or else if patient is Bhiru or Sukumara, do Jalauka. Do Jalauka Vachana. Yes? So this is, but along with that, you should see what is the Nidhana for the hair fall. Why the hair fall is occurring. So currently I am having 2 cases in my clinic. One aged 45 years, he is a cook. Adge Bhatru. So he is more exposed to the heat, due to which he is having hair fall. So that is Pitta related. Heat. Rakta Dhatu is involved and Pitta is involved. One more case is that it is due to tension. He just completed his engineering and is waiting for the placement. He is not getting since last 6 to 8 months. Again, apart from that, he used to eat all other unnecessary food from out. So again, here Vata Pitta. Manas also it is there. So again, what is the origin? Based on that, your prescription should go. And these points along with it. What is the origin is the must. Based on that, prescription should go along with these points. Now, that guy who is around, I guess, 24 or 25, he's having very minimal hair loss. Hair fall means I first day when I just what to say did like this on his head, full almost 50 hair were there on my hand. Now there is not a single hair. Hair fall has stopped. Now hair growth is seen, and even he had dandruff, itching sensation, full, that has been reduced drastically. Along with that, if you want to give Shodhana, it's up to you. How doshas are there involved in that particular patient. If there is a, like, if people come with what you say, people like pustules in hair, that time Shodhana is necessary. It might work, but it will take long time. So one Shodhana and then you start with this, you will get result very quickly. So based on how much the dosha is involved, dhatu is involved, that time you should use your yukti again over here, not whole and soul this. This will just speed up the reaction, as I told. Yes? Huh? Yes, Khalitya also same point. Huh. Hereditary, see, if it was hereditary, what I feel is it should be from birth only. From birth, very little amount of hair, it should be like that. It is because of nidana only. When you see, in particular family, they eat same food, same ahara, same vihar almost. And it is worse in younger generation because they do ratri jagarana, mobile is there, and they do whatever, like riding bike with without helmet, full pravata is there. All those nidanas matter. Because of that, hair fall will come. So based on what nidana you see, that is most important. Based on that, you should treat it. Because hereditary, it will be there. Means, at why it is not coming at that age only? If at all father is getting at 50 years, why the son is getting at 25, 28, like that? Why? Exactly. So you stop it there and there. And if at all father was given Shodhan or something, he would have also not faced that. And that will come. You might have seen, like a patient of, I guess, 70 to 75 years old came to Sir's clinic with no hair on his head. And within 6 months, he got hair. White hair. Very nice. Very densely populated hair. So that is how it is possible then. So that there is a nidana, there are doshas involved. That's all. We should see in that way only. If we keep on crying that this is hereditary, no. There is some nidanas. See, usually male will be having more of tension. Like how to, yes, females will also have, I'm not telling you. But they are blessed. They are blessed that they will not be bald. But males are not like that. So they have tension. ಮನೆಯಲ್ಲಿ ಇಷ್ಟೊಂದು ಇದೆ, ಹೌ ಫೈನಾನ್ಸ್, ಮನೆಯಲ್ಲಿ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಎಲ್ಲ ನೋಡಬೇಕು, ಮಕ್ಕಳೆಲ್ಲ ನೋಡಬೇಕು, ಆಲ್ ದೀಸ್ ವಿಲ್ ಬಿ ದೇರ್. That will also lead to that, pile upon to that nidana also. Though he is very nice, doing dinacharya, rutucharya, everything, but all those will be there now. And seriously, there is a study done that females will never get bald unless and until some external therapy like chemotherapy and all is there. Females will never get bald. That is blessing for female. Yes, some rare cases, 1 in lakhs, something like that you will get, but mostly in males.
How do you decide the number of sittings and bands?
Till we get the hair.
And old cases can we try it now?
Yes, Khandit. Daily it is good. daily twice also it is good. But how patient is like, see, suppose now what I am practicing is when patients are in and around my clinic, I call them daily. But some patients are far, I call them thrice a week. Daily twice also I call you where there is a severity of diseases more. Daily twice also I will call. So it is up to you, but minimum gap should be around 6 hours. Minimum gap of within with for the second sitting.
So here by doing this, are we making like ready for the scalp to absorb the water?
It's not like that. It's about what you say. First is improving the circulation and removing the doshas from that particular sthan. Basically, what is there is like when you see the khalitya samprapti, it is like kapha avarana to the hair follicles. Or else, if it is pittaja, it will burn the root of the hair follicle. So that's why the hair is not growing from that particular follicle. So when we do Rakta Mokshan, it is type of Rakta Mokshan Viddha Agni. So avaga doshas will come out. Some people who is due to Pitta Pradhana hair fall, they will bleed profusely on these points when you do. They will bleed profusely. It will take you some 1 to 2 minutes to stop that blood. Let it go. Don't press. Let it go. Just wipe it off. I told right the person who is cook, he bleeds every time. So much of doshas are there. He bleeds every time. One or the other point he will bleed. So don't stop. Let it go. Or let that doshas go. Now he is only telling. Currently he is taking treatment. It's been, I guess this week it will be 1 month. He is only telling, sir, dense is increased. The hair follicles are growing. I can see that. I didn't tell anything. I just asked him, "How are you feeling?" Sir, when I see the mirror, I could see the density of my hair has increased. 1 month. And simple pittahara aushadis. Simple. Huh? Dharma roller can be done in Indralupta, it will work nice. In Indralupta, it will work nice. Rather than this. This is like when we see we have to do Rakta Mokshana when the Vyadhi is all over the Vyadhi, either we do it in hand or in legs. It's like that. When the Vyadhi is occurring more space, these 6 points are because it is more painful, Dharma Lora. If I have not used, but I feel if you are irritating so much, it is more painful, I feel. I don't know. You can tell me, whoever has used, you can tell me the experience. Yes.
Do we need to shave the head?
No, no need.
Sir, kapha right? If we are able to find that there is kapha, then ಆಗ ಅಗ್ನಿಕರ್ಮ ಯೂಸ್ ಮಾಡ್ಬೋದಾ ಅವ್ರಿಗೆ?
Uh-huh. Uh-huh.
Because like ಆಗ್ಲೇ ಹೇಳಿದ ಶೀತ
ಹೌದು. But along with kapha, there will be pitta association in hair fall. When you see the samprap, there is pitta association. Okay. We'll go next. So sir, lunch break yaವಾಗ sir? 1 o'clock. Okay. So,
compared to Prachana Karma, you say Viddha Karma is more beneficial in Karma.
in Indralupta, Prachana is best because there is a small amount of hair loss over there. Whereas in normal hair loss, Khalitya, the area is huge. So where and all Prachana will do. So it's best to do on this points. And Indralupta, you see the Samprapti how it is, and then let me know. Along with that, there is one Krimi involvement also, I guess. Just check it. So can we use it? Can we do it on the patients who already lost most of the hair? Yes, they
yes.
have shiny surface.
Yes.
Will it work?
Yes. See my hair. When I was working like in Pune under a search clinic, the clinic was from 12 to 12, 12 in the noon till 12 in the night. So one thing, it was whole day standing, Kshaya. Second thing, Ratri Jagarana. Sometimes patient would be till 1:30 night. And the other thing is Katurasa Pradhana Ahara, mess. So all three I was consuming. So my hair was very, what do you say? Like if you would have seen that time, the scalp was visible. That much hair fall I had. We all used to do with from sir. At last, every when patients used to get over, we used to sit. Everyone. So within, I guess, 3 sittings of with the hair fall stopped. Hair fall stopped, and again regrowth was seen. And now I am in front of you.
There is no need to remove the hair at all.
No, no removal of hair, nothing. Just do with the on those points. Yes, if hairs are not there, it is better to assess. That's all. Or else you can take one instrument which is a microscope, electrical microscope. You will get on online. It is some 2,500 rupees. That's all. Where you can see the follicles. Each follicle should have around 3 to 4 hair. Each follicle should have. That is the normal. So later on, when the hair growth occur, you will see exactly from each follicle there are 4 to 5 hairs coming. So that's all. So till now, any doubts? So before going into eye, any doubts?
Sir,
Yes.
ಸರ್ ಪಿತ್ತ ಮಾಡ್ತೀವಲ್ಲ ಸರ್ ಮಾಡಿದಾಗ ಹೇರ್ ಗ್ರೋತ್ ಆಗುತ್ತೆ ಅಂತ ಇದ್ದೀರಾ ಹೇರ್ ಫಾಲ್ ನಿಲ್ಲುತ್ತೆ ಅಂತ ಇದ್ದೀರಾ ಹೆಂಗ್ ವರ್ಕ್ ಆಗುತ್ತೆ ಅದ್ರ ಬಗ್ಗೆ ಅಂದ್ರೆ ಆಯುರ್ವೇದದಲ್ಲಿ ನೋಡಿದ್ರೆ ಪಿತ್ತ ಶಮನ ಆಗುತ್ತೆ ಓಕೆ ಅದು ಹೇರ್ ಗ್ರೋತ್ ಆಗಬೇಕು ಮತ್ತೆ ಅಂತಂದಾಗ ಹೇರ್ ಫಾಲಿಕಲ್ ಡೆವಲಪ್ ಆಗುತ್ತೆ ಏನಾಗುತ್ತೆ ಅಂತ
ಈಗ ದೋಷಾಸ್ ಹೋದ್ಮೇಲೆ ದ ಧಾತು ಲೆವೆಲ್ ಇಸ್ ಸಮಧಾತು ಇರುವಾಗ ನಾರ್ಮಲಿ ಏನು ನಮ್ದು ಬಾಡಿದು ಇರುತ್ತೆ ಅದು ನ್ಯಾಚುರಲಿ ಗ್ರೋತ್ ಆಗುತ್ತೆ. ಅರ್ಥ ಆಯ್ತಾ? ಸೊ ಫಸ್ಟ್ ವಾಟ್ ವಿ ಆರ್ ಡೂಯಿಂಗ್ ಇಸ್ ವಿ ಆರ್ ಜಸ್ಟ್ ಟೇಕಿಂಗ್ ಔಟ್ ದ ದೋಷಾಸ್ ವಾಟ್ ಎವರ್ ಆರ್ ದೇರ್ ಇನ್ ಸ್ಕ್ಯಾಲ್ಪ್. When doshas are taken out, which are aggravated, which are dushana, which are being dushti, have undergone dushti, when they are taken out, obviously automatically the growth, hair growth will be seen. ಈಗ ನಾನ್ ಫರ್ಟೈಲ್ ಲ್ಯಾಂಡ್ ಅಲ್ಲಿ ನೀವು ಫಸ್ಟ್ ಏನ್ ಮಾಡ್ತೀರ? ಮ್ಯಾನ್ಯೂರ್ ಹಾಕ್ತೀರ, ಬೇಕಲ್ಲ ಅದು. ವೈ? ಬಿಕಾಸ್ ದೇರ್ ಆರ್ ದೋಷಾಸ್ ವಿಚ್ ಆರ್ ಇನ್ ದ ಸಾಯಿಲ್. ಟು subside those doshas alli ಏನು there is no nutrition at all, but we are adding their nutrition, not extracting from them, alwa. Similarly, but here we are extracting because already it is there in scalp or even in rakta dhatu, we can tell, because rakta is only one dhatu which is all over the body.
ಹೇರ್ ಫಾಲಿಕಲ್ ಅನ್ನು ಹೆಂಗೆ ಡಿಫರೆನ್ಶಿಯೇಟ್ ಮಾಡೋಕ್ಕಾಗುತ್ತೆ? ಅಂದ್ರೆ ಮತ್ತ ಇದೆ ಅಂತ
ಅದೇ ಕೇಳಬೇಕು ಮ್ಯಾಮ್, ನಿಧಾನ. ಎಸ್.
ಮೈಕ್ರೋಸ್ಕೋಪ್ ಅಲ್ಲಿ ನೋಡಿದಾಗ ಏನಾಗುತ್ತೆ?
ಹಾ, ಇಲ್ಲ ನೋಡಿದಾಗ ಯು ಕ್ಯಾನ್ ಡಿಫ್ರೆನ್ಶಿಯೇಟ್ ವೆದರ್ ದ ಪ್ರಕೃತಿ ಆಫ್ ದ ಹೇರ್, ವೆದರ್ ಇಟ್ ಈಸ್ ರೂಕ್ಷ, ಘನ, ಅಥವಾ ಕೆಲವ್ರಿಗೆ ಅರ್ಲಿ ಗ್ರೇಯಿಂಗ್ ಆಫ್ ಹೇರ್ಸ್ ಅಲ್ಲಿ ಇರುತ್ತೆ, ಅವಾಗ ಪಿತ್ತ ಜಾಸ್ತಿ ಇದೆ ಅಂತ. ಈಗ ಇಫ್ ಯು ಹ್ಯಾವ್ ನೋಟಿಸ್ಡ್ ವೆನ್ ಯು ಡೂ ಮೋರ್ ಆಫ್ ರಾತ್ರಿ ಜಾಗರಣ, more of night duties, when you do, you will see white hairs growing on your head. I don't know if you have noticed or not, but I do. I will have that thing. But when my sleep is proper, night sleep especially, I'm talking about night sleep, that time this white hairs will reduce automatically. So ಮಧ್ಯರಾತ್ರಿದಲ್ಲಿ ಪಿತ್ತ ದೋಷ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ಅವಾಗ that pitta prakopa is leading to this. Even you will get more of acidity issues when you do Ratri Jagarana, burning sensation, Amla Udgara, all those things. Commonly seen in IT people. They have night shifts, night meetings and all. Even in doctors who do night shifts. And if they don't properly sleep in the daytime as per the rule, what is there? Ardha, what you say, whatever we sleep in night, half of that we should sleep in daytime. So if that is not followed properly, and some people will eat and then sleep. That is also wrong. You first sleep and then you get up and then eat. So all those things matter. ಮತ್ತೆ ಕೇಳಬೇಕು ಸರ್. ಸೊ ಯೂಶ್ವಲಿ ವಾಟ್ ಇಟ್ ಈಸ್ ನೌ ಡೇಸ್ ಈಸ್ ರಾತ್ರಿ ಜಾಗರಣ ಇಸ್ ಮೇಡ್ ಇನ್ ಯಂಗ್ ಪೀಪಲ್. ರಾತ್ರಿ ಜಾಗರಣ ಒನ್ because of any exam related tension, other mobile, because of the screen they are not getting sleep only, they keep on watching reels, any videos, anything. Third thing is driving, pravata, that is again vata dushti there. Ratri jagarana again comes in pitta dushti. Eating outside food, especially Chinese, all of the junk foods which are katu, kshara, lavana yukta ahara, again goes in pitta. Some people eat excess of madhura also. They also have hair fall. So they are kafaja. So when you see the routine, see their ahara vihara in their routine, you will come to know what kind of hair fall they are having, and basically you can play medicines along with that. Viddha will be same, but medicine what you give or taila application what you give, that depends. You had doubt. No application. You just wipe it. That's all. No like as such pashchat.
Like any breakfast or anything that
That is up to you. That is up to you how you take it further. There are lepas. I guess in Ashtanga there is one lepa which includes tila, kamala, stamens of kamala, not nala, kinjalka. Kinjalka, there is one specific term they have used. Tila, kinjalka, amalaki, and madhu. They have told for kesha ranjana as well, kesha janana. This lepa. Wait, I'll tell the shloka only. तिलाः सामलकः पद्मकिञ्जल्को मधुकं मधु ब्रह्मयेद् रञ्जयेच्चेतत् केशान् मूर्धप्रलेपनात्. Reference Ashtanga Uttara 24/40. Also 41, there is one more shloka along with that. Mamsi kushtham tila krishna sariva neelam utpalam kshaudram cha kshira pishtani kesha samvardhanam param. Kesha samvardhanam param. So there again few more drugs are there. Mamsi, kushta, tila, krishna, sariva, neelam utpalam, neela utpala, kshaudra. Kshaudra we tell if we apply on hair, it is, but see, param. In both the formulation, madhu is the base where we mix the churnas. So go according to the shastras, don't just hear and then tell patients. Yes, so 41 to 42, this shloka is there in Ashtanga Hridaya. Uttara Tantra, Shiroroga Pratishedadhyaya, 24th chapter. You can make this churna and keep it in your clinic. Give it to patient. Apply it twice a week, once a week. You can get the results along with this. So easy. So
ಸ್ವಲ್ಪ ಆಚೆ ಈಚೆ ಆಗ್ಬೋದು, 1-2 mm ಆಚೆ ಈಚೆ ಆಗ್ಬೋದು, ಆ ಥರ ಅದಕ್ಕೇನಿಲ್ಲ. So the doubt was, next day when patient comes to do Viddha karma, there will be a mark. But if we do proper Viddha karma, mark won't be there. That is my experience. Mark won't be there next day. But also, if at all there is a mark, you can do 1 mm, 2 mm here and there. No issues. But exactly if you do 2 angulas, if you measure, you mark and then do on that mark, mark won't be there very next day. Or after 6 hours also it will be not there. If you do a second sitting on the same day. Any other questions before diving into eye? आंखों में डूबने से पहले कुछ क्वेश्चंस है तो? No? Because further it is more confusing, so it should not overlap with this, whatever we had done now.
A small basic question actually. Initially we discussed about a reference. Tatra ya sukshma shastra vidha avyakta masrasravati vijashobhavati sa vidha. So should we say or can we say that vidha karma is a type of durvidha?
No. That is, yes. So this reference, how we take it as, see, this reference is for Sira Vedana. So when Sira Vedana, while doing Sira Vedana, if there is a Durvidha, you will see this. But again, there is a reference that wherever we don't see any Siras, according to Ashtanga Hridaya. Also in Mamsala Pradesha, in this chapter only, previously, Mamsaleshu something it is there, 3 lines shloka it is there. They have told Ardha Vrihi we have to go inside, 1 Vrihi we have to go inside. So during that, this shloka should not be taken as Durvidha. This should be taken as the Vidha only. Samyak Vidha. So it depends on what type of Sira Vedana we have to do. This doubt comes to everyone. See, basically what it is like last class also I had told, Basti if you take. So amount of Niroha Basti is different, amount of Uttara Basti is different. Why so? Why it is so? Because the size of the srotas differs, no? Similarly here. So wherever we find Sira, you remove whatever amount of they have told, or till the blood stops on its own, you remove it. But when we are not finding, so now on the Kapala, where will find the Siras? If it is a person who is more angry, you will find. But on normal people, we won't find, right? And that too in Upanasika Pradesha, even in Apanga Pradesha, Bhrumadhya, where we will find the Sira? No.
So suppose we are in a situation where we actually find the Sira. What can help us differentiate between whether we have to do a proper full-fledged Sira Vedha or we
Sira Vedha.
Go for
Sira Vedha. If you find Sira.
If I find the Sira.
Yes, in Gridrasa also, if you find Sira, 4 angulas above, below the Janu, do it. But again, sometimes person not sitting in front of you, patient, may faint. Or when it is Sukumar, or when they are not willing, you can tell, when it will be like mosquito biting you, that much pain you will have. That's all. And very minimal amount of rakta will be. So this is more used that time. Even in Garbhini, Bala, that time you can't take rakta, that much of amount of rakta.
Got it. Nice.
Anyone else? Anyone else? No? Shall we jump into the well? So I'll just explain this instrument. But before that, any Shalakya PG 1 I have seen. Anyone else is there here? Shalakya PG? Yes. So I will be needing your help. Okay? To explain this instrument. I am not a
well versed in this instruments actually, but with the help of those PGs, we will learn how to use this instrument. Yes, everyone knows what is this ophthalmoscope. What we see. Can anyone of you come and tell how we should use? Just brief. Anyone of you. Just briefly, you tell how to use this instruments. Then I will share my knowledge, whatever I have. How to hold, how to see, all those things, basic points.
Okay, so this is an ophthalmoscope. Okay, so first of all, how to hold this? This is held here. This silver part that we are seeing here, it is held like this. So rod ಇಟ್ಕೊಳ್ತೀವಲ್ಲ ಅದರ just ಹೀಗೆ ಇಟ್ಕೊಳ್ಳೋದು. And how to switch it on? ಇದೆಯಲ್ಲ ಇಲ್ಲಿ ಹಿಂಗೆ ಟರ್ನ್ ಮಾಡೋದು ಕಾಣ್ತಿದೆಯಲ್ಲ. This thing. This is for the brightness. Okay. Swalpa brightness haku patient if he is sensitive to light and all that. Swalpa turn ಮಾಡಿದ್ರೆ ಬರುತ್ತೆ ಇಲ್ಲಿ ಕಾಣ್ತಿದೆಯಲ್ಲ. So ಹಿಂಗ್ ಬರುತ್ತೆ. ಇನ್ನು ಜಾಸ್ತಿ brightness ಬೇಕಂದ್ರೆ you can turn it how much ever you want. This is the way to switch it on. And also ನಾವು ನೋಡುವಾಗ ಹೆಂಗ್ ನೋಡ್ಬೋದು. ಕನ್ನಡಕ ಹಾಕೊಳ್ತಿರೋರಿದ್ರೆ ಬೆಟರ್. ಕನ್ನಡಕ ತೆಗೆದ್ಬಿಟ್ಟು ನೋಡೋದು is better. Okay. So I basically remove my spectacles and then I want someone to help.
You can show on them.
Yeah. Before that, what we can see using the Santa Norana. One main thing is cataract, easily diagnosable through this for anyone is the cataract. So if you have this instrument and you learn how to see through it, first thing is cataract that you will be able to see. Hinge normal ag noduvaga I tell you how to see. You will be able to see a red glow. Okay, through the pupil if you see, you will be able to identify a red glow inside the pupil. If there is any obstruction to the red glow that is there, another black masi tara kanodu or any black spot to the red glow obstructing your red glow, that could be 80% of the times that could be a cataract. Okay, ಆ cataract ನಾವು ಇವಾಗ undilated pupil ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂದ್ರೆ undilated ಅಂದ್ರೆ ಈಗ normal all our pupils are undilated. So in undilated pupils, just in the center ನಾವು ಅಷ್ಟೇ ನೋಡಕ್ಕಾಗೋದು. Dilate ಆದ್ರೆ the whole thing will be visible, whole lens will be visible. Dilate ಆಗಿಲ್ಲ ನಾರ್ಮಲ್ ಹಿಂಗ್ ಡೈರೆಕ್ಟ್ ಆಗಿ ಕೂರಿಸಿ ನೋಡ್ತಿದೀವಿ ಅಂದ್ರೆ ಚಿಕ್ಕದಾಗಿರುತ್ತೆ pupil. So that time it is undilated and you will be able to see cataract which is located in the center only, not in the sides. So this is one main thing that we can see, the cataract. And next, as we progress into learning how and what to see through this ophthalmoscope, we'll also be able to see the retina. Retina color. First thing is the color of the retina that we'll be observing. ಕೆಲವೊಬ್ಬರಲ್ಲಿ it will be very red or sometimes it can be a bit pale. ಆ ಥರ varied colors ಕಾಣುತ್ತೆ ರೆಟಿನಾದಲ್ಲಿ. Those varied colors tell us about the health of the retina. ಆ patient ಅಲ್ಲಿ ಹೆಂಗೆ ರಕ್ತ ಹೆಂಗಿದೆ, how is it? If it is pale, there could be some avarodha causing present there, causing not the required amount of blood to reach there. So avarodha idirbodu. Or if it is too red, then we could understand that there could be probably some pitta involved or any udavarta conditions. In such conditions, it could be very red in color. So there are colors of red and shades of red we can be we can identify. These are two basic things that we see. Later on, retina nodak bandaga, retinadalli there is optic disc, there is macula. Retinadu ಇದು ಗೊತ್ತಾ? I mean, how it
Circle.
is. If do you have a picture of it?
Sure, ಇಲ್ಲ. ಇಲ್ಲ.
Okay, it's okay. If you can Google it and see, ರೆಟಿನಾದಲ್ಲಿ ಒಂದ್ ಕಡೆ ಆಪ್ಟಿಕ್ ಡಿಸ್ಕ್ ಇರುತ್ತೆ, ಆಪ್ಟಿಕ್ ಡಿಸ್ಕ್, ಅಂಡ್ there is ಅದ್ರ ಪಕ್ಕದಲ್ಲಿ there is a spot called macula. ಸೊ ಹತ್ರ ಹೋಗಿ ನೋಡುವಾಗ ನಮ್ಗೆ ಆಪ್ಟಿಕ್ ಡಿಸ್ಕ್ ಕಾಣುತ್ತೆ. ಇದೆಲ್ಲ you can learn this only by practicing. Like repeatedly, if you keep on seeing, you will be able to learn. We'll go to it later. First, initially, cataract and the color of retina is very important that we have to learn. That we'll see. Okay. ನೀವು ಆನ್ ಮಾಡ್ಕೊಂಡಾಗ ಇದರಲ್ಲಿ ರೌಂಡ್ ಬರುತ್ತೆ. ರೌಂಡ್ ಅಲ್ಲೂ ಲೈಕ್ ಕಾಣ್ತಿದೆ ಕೈ ಮಾಡ್ಕೊಂಡು, ರೌಂಡ್ ಅಲ್ಲೂ ದೊಡ್ಡ ರೌಂಡ್, ಸ್ಮಾಲ್ ರೌಂಡ್ ಇದೆಲ್ಲ ಇದೆ ಲೈಟ್. ಅಂಡ್ ದರ್ ಇಸ್ ಒನ್ ಲೈನ್, ಇದು ಸ್ಲಿಟ್ ತರ ನೋಡುತ್ತೆ. ಅಂದ್ರೆ ಓನ್ಲಿ ಒನ್ ಪೋರ್ಷನ್ ಇಫ್ ಯು ವಾಂಟ್ ಟು ಸಿ ದಿಸ್ ಕ್ಯಾನ್ ಬಿ ಯೂಸ್ ಸ್ಲಿಟ್. Initially round and slit, that's all we'll see. So I've kept it for round. Okay, we'll see. Patient will be seated in front of us. It's better if we stand because mobility it is easier if we stand. So first to diagnose cataract, we see from a distance. ಹಿಂಗೆ ದೂರದಿಂದ ನೋಡ್ತೀವಿ. And sorry, I forgot to tell about one thing. ನಮ್ಮ ಕಣ್ಣಿಗೆ ಪವರ್ ಇದ್ರೆ ಇದ್ರದ್ದು ಲೆನ್ಸ್ ಅಲ್ಲೂ ಪವರ್ ವೇರಿಯೇಷನ್ಸ್ ಬರುತ್ತೆ. So that we can change like this. Okay. So based on your eye power, ಇಲ್ಲಿ lens can be changed. So that it is person specific, you can decide. Ask the patient to look straight, look into anything straight, and from a distance you have to observe. You note that you will be able to see a red glow or an orange glow. Okay? If there is any obstruction to it, then as I told you, cataract will go 80% of the times. So in her there is no such obstruction seen, so it is clear, no issues. Then to see, also I could see the color of her retina. Initially, ದೂರದಿಂದನೇ ಕಾಣುತ್ತೆ the color of the retina. It is kind of between yellow and orange, not very red. Okay, so ನಾನು ಇದನ್ನ ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಆಗಿ ಹೇಳ್ತಾ ಇಲ್ಲ, ಬಟ್ ಜಸ್ಟ್ ಅನ್ ಅಬ್ಸರ್ವೇಷನ್. ಸ್ವಲ್ಪ ರೆಡ್ಡಿಶ್ ಆಗಿದ್ದಿದ್ರೆ ಹರ್ blood supply to the retina is very good ಅಂತ ಗೊತ್ತಾಗ್ತಿತ್ತು. Since it is a bit lesser than the reddish tinge, probably ಅಲ್ಲಿ blood supply ಅಷ್ಟು ಚೆನ್ನಾಗಿಲ್ವೇನೋ would be the observation that we can make. And to see the retina, you have to go closer. And the optic disc, macula, all that I was saying. ಅದು ನೋಡ್ಬೇಕಂದ್ರೆ you have to go really close. ಹೋದಾಗ we can see the blood vessels. ಒಳಗಡೆ capillaries, blood vessels ಏನಿರುತ್ತೆ we can see. If we go on tracking the blood vessels, we'll arrive at a junction that is called the optic disc. Optic disc ಅಲ್ಲಿ ಎಷ್ಟೊಂದು blood vessels ಬಂದು one point ಅಲ್ಲಿ ಕೂಡ್ಕೊಳ್ತಾ ಇರುತ್ತೆ, that is the optic disc. ಅಲ್ಲಿನೂ ಅಷ್ಟೇನೆ ಎಷ್ಟು ಬ್ಲಡ್ ವೆಸಲ್ಸ್ ಹೋಗ್ತಾ ಇದೆ, ಅಲ್ಲಿ ಏನಾದ್ರೂ ಯಾವ್ದಾದ್ರು ಬ್ಲಡ್ ವೆಸಲ್ಸ್ ಹಾಲೋ ಕಾಣ್ತಾ ಇದೆಯಾ ಅಥವಾ ಕಲರ್ ಇಲ್ಲದೆ ಇರೋ ಬ್ಲಡ್ ವೆಸಲ್ ಕಾಣ್ತಾ ಇದೆಯಾ ನೋಡ್ಕೊಂಡು, ಏನಾದ್ರೂ ಅಲ್ಲಿ ಬ್ಲಡ್ ವೆಸಲ್ ರಿಲೇಟೆಡ್ ತೊಂದರೆಗಳು ಎಷ್ಟೊಂದು ಬರುತ್ತೆ ರೆಟಿನಾದು, ಅದು ಯಾವ್ದಾದ್ರು ಇದೆಯಾ ಅಂತ ಐಡೆಂಟಿಫೈ ಮಾಡ್ಕೊಳ್ತೀವಿ. ಎನಿವನ್ ವಾಂಟ್ಸ್ ಟು ಟ್ರೈ ದಿಸ್?
1 or 2. Quick, you won't get any other chance. Go. Just see and
ಆನ್ ಮಾಡ್ಕೊಂಡು ನಿಮ್ಗೆ ಇಟ್ಕೊಂಡ್ರೆ ಲೈಟ್ ಬರ್ತಿದೆಯಾ ಗೊತ್ತಾಗುತ್ತೆ. ಯು ಹ್ಯಾವ್ ಟು ಕೀಪ್ ದಿಸ್ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ವೆರಿ ಕ್ಲೋಸ್ ಟು ಯುವರ್ ಐ. ರೆಡ್ ಗ್ಲೋ ಮಾಡಿಸ್ತಾ ಇದೆಯಾ? Red glow is unobstructed. Near ಅಂದ್ರೆ ಇಟ್ಕೊಳ್ಳಿ, ಹತ್ರನೇ ಇಟ್ಕೊಳ್ಳೋದು. And identify the red. ಈ ಕಡೆ go closer. You have to go closer. This is the blood vessels. Okay, but you could identify blood vessel, no? Okay. And blood vessel identify ಆದ್ಮೇಲೆ you can learn tracking.
So it is a step-by-step process. One sitting you can't learn.
And one thing is right, numb right eye and patient's right eye model use. Numb right and patient right. ಅಲ್ಲ ನಿಮ್ದು ರೈಟ್ ಅದು ಚೇಂಜ್ ಮಾಡ್ಕೊಳ್ಬೋದು. ಇನ್ವಿಷನ್ ಹಾಗಾಗಿ ಇಲ್ಲಿ ನೀವು ಹತ್ತಿರ ಇರುತ್ತೆ ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಕ್ಲೋಸ್ ರೆಡ್ ಗ್ಲೋ ಕಾಣ್ತಿದ್ಯಾ? ಅದು ಪ್ರಾಬಬ್ಲಿ ಆ ಸೈಡ್ ನಿಮ್ಮ ಲೆಫ್ಟ್ ಅವ್ರ ಈ ಸೈಡ್
ಇದು ಸರ್ ಅದು ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ಮೇಲೆ ಲಂಚ್ ಬೇಕಾಗಲ್ಲ, ಆಮೇಲೆ ಐಸ್ಗೆ ಡೀಟೇಲ್ ಆಗಿ ನಂದು ಗಂಟೆ ಹಾಂ ಆಗ್ಬೋದು. ಹಾಂ ಡೆಮೋ ಮಾಡ್ಬೋದು. ಹಾಂ ನೋಡೋಣ ಎಷ್ಟು ಹೊತ್ತು ಆಗುತ್ತೆ ಅಂತ ನೋಡೋಣ. ಹಾಂ
So is there anything specific that you want me to do? Or just
this is enough.
Okay, so by practice you will know how and what to see. This is how we use this instrument.
Thank you, ma'am. So, time for a story session now. So, what we like while we were learning under sir, so we used to see sir using this instrument in eye-related disorders. So we asked sir, हमको भी सीखना है, हमको भी इसमें क्या क्या देख रहे हो देखना है सर, और हमको कैसे वो मेडिसिन कैसे यूज करते हैं वो देखना है. So sir told okay, next day morning he will be taking class at 8:30 a.m. So he told one of the student to bring this ophthalmoscope to his home. So we went next day, class started. Then like first he was just reading whatever he used to teach, and then somehow we remembered, sir, ಇದು ಹೇಳಲೇ ಇಲ್ಲ ಸರ್ ನೀವು ಆಫ್ಥಲ್ಮೋಸ್ಕೋಪ್ ಹೇಗೆ ನೋಡೋದು ಏನದು ಹೇಳಲೇ ಇಲ್ಲ. Then he started, how ma'am started, like there will be a light which you can adjust, and various types of lights will be there. One circle, slit, sometimes half circle, all those things. Then sir is like, only this much is there. Then we ask, sir, what do you see inside? How to identify what exactly the case is? Then as ma'am told, like whatever the varna you see, based on that you see the doshas. That is secondary. Macula you see, optic nerve you see, whatever other what you see, anatomical structures you see, that is secondary. But what mainly, sir, you said what mainly I see is which dosha is present. So when you see, if it is clear vision, then it's normal. Clearly you are able to see. But sometimes there, I guess I am, if I am wrong, tell me ma'am. Okay. There sometimes there will be something blur vision inside the eye. That is kaphaja. Sometimes it will be bright red, as ma'am told. Bright red. It might be due to pittaja or raktaja involvement. Sometimes somewhere it will be somewhere discolored, somewhere here and there it will be discolored. That is purely vataja. So based on these findings, your prescription should go here and there. So use modern instruments to see doshas. Doshas are visible. Ma'am, what she told, it's good. It's that observation. But first, as she also told, how it is visible, how clearly it is visible. That you have to see first. So, like, what is your first sight? Based on that, you will come to know which dosha is involved over there. And that's how you again classify whether it is in Vataja, Pittaja, Kaphaja or Raktaja. They have specifically told the Varanas, right, in each and every diseases. So see that. When you hold it, see that. Learn the basics. How to on the ophthalmoscope, how to switch, which and all areas you have to see, how to switch it, how to switch the lens. All those you should learn. But what you see, you should see the doshas. This sir told us. And sir told, I am not a Shalakya MS or something, which I can see all those optic nerve. I am least bothered about that. I just want the doshas inside, whatever are vitiated in the eye. I just want that. Rest all, when the doshas are treated, other things will be in proper line. Is it so? Yes? Ma'am, correct na? Initially, you just see the colors. Then, obviously, the macula, fovea, optic nerve, all those you will see later. But what color, how clear it is, based on that, you should see first which dosha. Or else, we will just write tripalagrata, tripalagrata, tripalagrata. But why tripalagrata? Which dosha it is acting on? Why not Jivantadigrata? Why not Durvadigrata? Why not Sarivadivati? Where to use Sarivadivati? Why not Chitrakadivati also? If doshas are so much that you give Panchakarma, they have told, right? Shodhana is also needed in Shalakya diseases also. Bastis are told. Netra bastis are told. So give that. I just wanted to give one way, other way. Modern way is yes, you should know. But one other way where we should diagnose is it Ayurvedically. Ma'am also told, like if it is brighter side of red, there might be Rakta involvement. If there is a pale, there's some avara due to kapha. ಆಗ್ಬೋದು. Then you trace the nidanas, how it happened. Ask him, what is your occupation? Ask him the related questions, whatever. First you see darshana. Sparshana, you can't do sparshana in eye. Then you ask prashnana. That's how you do examination, right? So this is one more view how you see towards the diseases. Basically, see what Ayurveda sees is as a whole, which dosha. Doshas are all over the body, maybe it eye, nose, ears, wherever it be. When those doshas are corrected,
when those doshas are in Samavastha, that disease will automatically go. Same Laghu Sutta Shekara can be given when there is a burning sensation in eyes. Same Laghu Sutta Shekara can be given when there is Pitta Prakopa, when there is Amlodgara, when there is acidity, burning sensation. Same, no? What we are doing, we are correcting the doshas by giving the medicines. We are not like target specific, we are not treating. Any diseases you see, we are not treating it target specific. Most of the times, we are going for balancing the doshas. That's all. Anything you take, any vyadhi you take. Or else, why would have they told Shodhana in Netra Rukas? Why would have they told giving Basti in Netra Rukas? Where we give Basti and where the Netra is. It's like acting in Kanyakumari, action is seen in Kashmir. Yes or no? So why? Because there is some relation, some like network is there, and that network is doshas. You can't explain it into the modern terms. Understood? So when you start looking in this way, you will understand it better. Why Ayurveda is telling like that. Or else, Acharya Shushruta has told the Drushtigata rogas, right? A small Sarshapavat it is, right? The size is so small. Sir usually tells why not he would have given pancreagata rogas, kidney gata rogas. Why not? Lungs gata rogas. Why not? They didn't see that. So beautiful dissection they have explained, but they didn't see that. They didn't see the gallbladder stones they didn't see. So usually when we see in practice, when there is a gallbladder stone, we give Pashana Bheda Churna, all those things. Why? See where the Agni is going wrong. You will get the cause. It's nothing but the Pitta which is getting hardened over there. If we see like that anatomically. But when we see the Nidanas, you can see in Grahani, some can see in Gulma. Why are we not searching in this? Why are we going target specific again? Yes. So just see overall which dosha is predominantly seen. Yes. Any doubts till now? Because next it is bit complicated. Any doubts? This will give the by looking through ophthalmoscope, we will be sure shot that this dosha is vitiated in the eye. So we should act accordingly. Yes, we can guess through the lakshanas what we see in the patient. Patient will tell, I am not able to see that much far. Some blurriness is there. All those things will be there. Burning sensation is there. But still, if you want to be sure shot, some critical cases like what you say, RP, retinitis pigmentosa. In that, which dosha is there involved, you should see that. Yes, blindness is there, but through which dosha? Their patient can tell I have burning or just in nothing they will tell. But which dosha is there inside? You need an instrument. You need a lens. And that is ophthalmoscope. Or else, see, this ophthalmoscope they also use. Ophthalmologists also use. They see macula, they see what optic disc. They see those also, but still why they are not able to treat it? They tell we can't treat retinitis pigmentosa. One doctor who, when I was practicing in Bangalore,
She is ophthalmologist in Narayan Netralaya. Last week she called me, sir. Such and such a patient is there, retinitis pigmentosa. I am sending it to you. I have seen the results. Because in our science there is nothing. So if we see diagnose according to them, we also will not get results. We also will not get results. If we see, okay, optic disc is damaged, optic nerve is damaged, macula is damaged, all those if we see in their parameters, we also can't do anything. We should see in doshas, which dosha is balavan in that particular site. Do you agree? Yes. Similar thing happens in infertility. There is a block, fallopian tube block. If we go behind the block only, nothing will be there. By which dosha it is coming? Whether it is increased vata dosha, pitta dosha, kapha dosha, ask patients all the nidanas and treat accordingly. Give shodhana accordingly and see the results. But what we see is reports. It is necessary, but first ask. Ask what patient is experiencing, what she is experiencing, what he is experiencing. Ask. Based on that, you then see the reports. Based on that, you use your yukti and decide which dosha is predominant. Don't see which tissue is more, which adhesion is more. Don't see that. See which dosha is predominant and work accordingly. That is only the difference. Or else there is a well equipped technique with them, IVF, IUI, but still they are failing. Why? Because there is something beyond that, right? Which Ayurveda solves. Which Ayurveda solves. Based on that, you see. There was one lecture of Dr. Viddha Agni sir, where he tells most of the infertility is due to males. Why I'll tell. Every day while bathing, what do you use? Soap. Soap is alkaline. Kshara. Kshara does Shukra Shaya. So that minute nidana can also lead that. I am going beyond the topic, but I am telling how we can see the nidanas. Understood? Even brushing with nowadays all madhura rasa pradhana dravyas. And they have told to chew. Bhakshaye danta dhavana. So that minute thing will be the nidana. Who knows? All these minute details will fetch you more nidanas in the patient. Yes, in sperm analysis you can see the motility rate, everything will see. But what is the bala of the sperm you will see? No. That only can be assessed how the charya of that person is. Person is doing hell lot of night duty. Person is doing delivery kelsa. Swiggy, Zomato, they are riding like hell. In a day, 100 kilometers they are riding. So much of kshaya is happening. Are we focusing on that? Okay, all the reports are normal, done. No problem is there. Still they are not getting a baby. Why? Are we seeing these details? No. That time your diagnosis will be accurate when you see all these details. When you see through Ayurvedic way. Which dosha, which gut. Similarly in eye. Eye is so important.
sense organ. That's why they have told Drishtigata Rogas. They have dedicated so entire chapter. They would have dedicated for liver also, pancreas also, spleen also, everything alone. But that can be treated through the doshas, which are going up and down, up and down. You bring those dosha to the samya avastha, you can treat that vyadhi. But this, it has specific treatment. That's why he has given that particular chapter. Masura dala matram, trishti. One small avayava. So I just wanted you to see in this perspective. That's why I'm taking so much of time. Because further, when I explain the points, those points are there in Manasaka Rogas also. Those points are there in other Vyadhis also. Similar points which are used in Netra Roga. Then you will have that questions that, sir, this point is told in this Vyadhi also, this point is told in Adimanta Abhishanda also. How come? So that reach is not only limited to the eye. You are stimulating the brain centers over there. Understood? Yes. So we have 15 minutes. We can have one demo. Whatever points we saw it today, we can have one demo. Any volunteer, please?
First
Yes.
time ಬರ್ತಾರೆ.
हाँ. 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 Needle? हाँ. So anyone is having whatever problems we have discussed now can come. Any. Hair fall. So most common will be hair fall only. So what is the complaint?
Actually, ನಾನು ಆಕ್ಚುಲಿ ಬ್ಯಾಂಗ್ಳೂರ್ ವರ್ಕ್ ಮಾಡಬೇಕಾದ್ರೆ ನೈಟ್ ಸಲ ಮಾಡ್ತಾ ಇದ್ದೆ. ಸೊ ಆವಾಗ ಬಂದ್ಬಿಟ್ಟು ಕ್ರೈನ್ ಇತ್ತು ತುಂಬಾ ಕ್ರೈನ್ ಆಲ್ಸೋ ಹೇರ್ ಫಾಲ್ಸ್ ಇತ್ತು. ಸೊ ಇವಾಗ ನಾನು ಮೊಬೈಲ್ ಶಿಫ್ಟ್ ಆದ್ಮೇಲೆ ಡೈಗೆಲ್ಲ ಕಮ್ಮಿ ಆಗಿದೆ, ತುಂಬಾ ಡೈ ಕಮ್ಮಿ ಆಗಿದೆ. ಹಾಟ್ ವಾಟರ್ ಯೂಸ್ ಮಾಡ್ತಿಲ್ಲ. ಮೊದಲೆಲ್ಲ ನನಗೆ ಗೀಸರಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತಿದ್ದು. ಆಮೇಲೆ ಹಾಟ್ ವಾಟರ್ ಯೂಸ್ ಮಾಡೋದಂತೆ ಓನ್ಲಿ ಕೋಲ್ಡ್ ವಾಟರ್ ವಾಶ್ ಮಾಡ್ತೀನಿ. ಪ್ಲಸ್ ತುಂಬಾ ನಿಧಾನ ಸ್ವಿಮ್ ಮಾಡಿದ್ದೀನಿ, ಅಂದ್ರೆ ನೈಟ್ ಟೈಮ್ ನಿದ್ದೆ ಕರೆಕ್ಟ್ ಆಗ್ತಿದೆ. ಆಯಿಲ್ ಫುಡ್ ಕಮ್ಮಿ ಮಾಡಿದ್ದೀನಿ. ಸೊ ಗ್ರೈನ್ ಕಮ್ಮಿ ಆಗಿದೆ, ಬಟ್ ಹೇರ್ ಫಾಲ್ ಕಮ್ಮಿ ಆಗಿದೆ,
ಬಟ್ ಇನ್ನೂ ಇದೆ,
ಹೇರ್ ಗ್ರೋತ್ ಇಲ್ಲ,
ಡೆನ್ಸಿಟಿ ಕಡಿಮೆ ಆಗಿದೆ. So when we see the nidanas, rough idea, it is due to pittaja. So unpopulated hair it is there right now. He is feeling. Okay, because he knows what he had, what hair he had prior, right? So same again, pittahara line of treatment should be internally, whatever you take in your ahara, in your vihara, in your aushada. Apart from that, this points you will take. So pittahara you can take starting from dhanya ke hima also you can start. हाँ. Yes.
ಇಲ್ಲಿ ಓಕೆ.
So depends. So basic aushadha starting from dhanya ka hima also you can use, or give some shitala dravya to do danta dhavana also. From that basic thing you can use. Sometimes there was one case, one of my senior was treating of infertility. Everything was done. Vamana, Virechana, Basti, Rakta Mokshana. Everything was done. Why she is not conceiving? Then somewhere she had read that Nasya. So she started simple Anutaila Nasya. Within 2 months, she got cancer. Where is Nasya? Where is reproductive? All those things, minute things, we forget. So first thing is locating the shikha.
ಮಾರ್ಕರ್ ಸ್ಕೇಲ್ ಇದೆ
ಮಾರ್ಕರ್ ಕಾಣುದಿಲ್ಲ ಸರ್.
ಸ್ಕೇಲ್ ಅಂಗುಲಂ
ಹಾ. So locating the shikha. So this point, whatever I am marking over here, this is shikha, exact middle point. Yes. So from here in front we should go 2 angulas. 2 angulas, again we have to count of the patient's 2 angulas. So we should ask patient to do like this, or even more accurately if you want, do 4 angulas and then take an average. Even more further, use vernier caliper. So we'll go with scale only. So approximately 4 centimeter is his 2 angulas. So from shikha 4 centimeter in front. So this line we get 4 centimeter, first line. Yes, so this first line. So on the lateral side, again from midpoint, go 4 centimeter here. 4 centimeter here. Similarly, again next point when you take 4 centimeter front. 4 centimeter here, 4 centimeter there. Third point, 4 centimeter here, 4 centimeter there. Understood? So these are the 6 points. Yes? Now we'll do them. So we are using 26.5 needle, which is 1 vrihi pramana. So I'll just measure 2 angulas like this now for convenience. So this is 2, 2. So first is here. That's all. No blood is coming, but yes, we did 6 points. Understood? Saw? Yes? Thank you.
ಕ್ಲಿಯರ್
Huh.
ಇಸ್ ಇಟ್ ಕ್ಲಿಯರ್ ಮತ್ತೆ ಯಾರಿಗಾದ್ರೂ ಬೇಕಾ
Huh? So in girls also, if there is lot of hair fall, you can do this. It's not about baldness, it's about hair fall. Okay. So shikha, from shikha 2 angulas front. 1, 2. 2 angulars front, 2 angulars side. See, blood is coming. So, Nidana Jano.
Dosha is coming.
ಟೆನ್ಷನ್ ಇದೆ ಅಲ್ಲ.
ನಾಳೆ ದಿನ ಮಾಡ್ಲಪ್ಪ.
Thank you. So saw the blood coming out. Same, huh? Hair fall ಏನು
ಅಥವಾ
ಕಿವಿ ಪ್ರಾಬ್ಲಮ್ ಯಾರಿಗಿಲ್ಲ? ಹಾ, ಹಿಯರಿಂಗ್ ನೀವು ಇವ್ರಿಗೆ ಆದ್ಮೇಲೆ ನಿಮ್ಗೆ ಮಾಡಿ. ಹಾ, ಸ್ವಲ್ಪ ಪ್ರಿಕ್ ಅಷ್ಟೇ. Three centimeters. Her 2 angulas is 3 centimeters. So first Shikha. Shikha in the 3 centimeters. 3 centimeters ಇಲ್ಲಿ. So ಹೀಗೆ. So 3 centimeter ಆ ಕಡೆ. 3 centimeters ಮುಂದೆ and side. Okay. One more. That. ನಿಧಾನ ಏನಿದೆ? ಹಾ, ಪಿತ್ತವರ್ಧಕ. I can make out the palitya. Graying of hairs. Usually graying of hairs is related to pitta. ಹಾ. ಕರ್ಣಕ್ಕೆ ಕರ್ಣ
ಒಂದು ಕರ್ಣ ಬ್ಲಾಕು ಇದೆ ಒಬ್ಬರಿಗೆ.
ಹೌದಾ? ಯಾರಿಗೆ?
ನನ್ನ ಹೆಂಡತಿಗೆ.
ಮಾಡು. ಏನಾಗ್ತದೆ?
ಸರ್ ನನಗೆ ಅವಾಗ tinnitus ಆಗುತ್ತೆ in my left ear.
ಓಕೆ, ಟೆಲ್.
I get tinnitus in my left ear. Generally it is when I'm going to have migraine or something ಅಂದ್ರೆ ಆಗ ಜಾಸ್ತಿ ಅನ್ಸುತ್ತೆ.
ಈಗ ಇದನ್ನು
ಇಲ್ಲ, ಬೆಳಗ್ಗೆ ಇತ್ತು.
ಇತ್ತು.
when I was traveling.
ಹಾ.
ಸೊ ಬೆಳಗ್ಗೆ ನಾನು ಬೆಂಗಳೂರಿಂದ ಟ್ರಾವೆಲ್ ಮಾಡ್ಕೊಂಡು ಬಂದೆ, ಆಗ ಅನ್ನಿಸ್ತಾ ಇದೆ.
ಯಾವಾಗ ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಅಪಾರ್ಟ್ ಫ್ರಮ್ ಮೈಗ್ರೇನ್?
ನೋ, ಅಂದ್ರೆ ಈಗ ಇನ್ನು ತಲೆನೋವು ಶುರು ಆಗುತ್ತೆ ಅಂತ ಅಂದಾಗ ನನಗೆ ಆ ತರ ಪೇನ್ ಬರುತ್ತೆ. ಅಂದ್ರೆ ಐ ಕ್ಯಾನ್ ಫೀಲ್ ದಟ್ ದೇರ್ ಇಸ್ ಸಮ್ ಬ್ಲಾಕ್ ಆರ್ ಸಮಥಿಂಗ್ ಅಂಡ್ ಐ ಕ್ಯಾನ್ ಹಿಯರ್ ಸಮ್ ಸೌಂಡ್. ಅಂದ್ರೆ ತುಂಬಾ ಹೊತ್ತಿರಲ್ಲ, 1-2-3 seconds ಇರುತ್ತೆ. ದೆನ್ ಐ ಹ್ಯಾವ್ ಟು ಚೇಂಜ್ ಮೈ ಪೊಸಿಷನ್. ಚೇಂಜ್ ಮಾಡಿದ್ರೆ ಸರಿ ಅನ್ಸುತ್ತೆ. ಅಂಡ್ ಅದಾಗಿದ್ಮೇಲೆ ನನಗೆ ತಲೆನೋವು ಬರುತ್ತೆ. ಲೈಕ್ ಆಫ್ಟರ್ ಸಮ್ ಟೈಮ್ ಐ ವೇಟ್ ಲೈಕ್ 5 to 6 hours ಅಲ್ಲಿ ನನಗೆ ತಲೆನೋವು ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ. ಇಫ್ ಐ ಡೋಂಟ್ ಡ್ರಿಂಕ್ ಎನಫ್ ವಾಟರ್ ಆರ್ ಸಮಥಿಂಗ್, ಅವಾಗ ನನಗೆ ತಲೆನೋವು ಬರುತ್ತೆ.
So here it is because of Shirashula leading to Karna Nada. So the Moola Vyadhi is separate. So we have to treat that, then only we will get to know the Karna Nada will come down. Do you use earphones?
ನಾಟ್ ಮಚ್.
ಆ ಥರ ಇಲ್ಲ. ರಾತ್ರಿ ಜಾಗರಣೆ ಇದೆ?
ಸ್ವಲ್ಪ 11, 10, 30, 11.
ಓಕೆ. ಅಜ್ಜಿನ we will demonstrate the Karnagata points also, but before that we will take Shiroroga points. I missed it. I will tell now. Shiroroga point is usually Bhrumadhya, in between the eyebrows, and Kapala. Kapala, how you should take is, there is a eyebrow angle here. lateral 1/3 usually the angle will be. From here when you go up in 45 degrees, wherever there is a Keshanta Sandhi, that is Kapala. Everyone will have different Kapala point. So we will take that and then take Karna Roga points. Okay. So based on your forehead, your Kapala will vary. Based on your hairline, Kapala will vary. Just a minute. So how to do Bhrumadhya? Bhrumadhya is usually when we draw a line from the end of both the eyebrows. So sometimes it might be ending here, it might be ending here, but here it is bit down. So when we draw a line on the end, exactly the midpoint is Bhrumadhya. ಅದು ಕಾಣುತ್ತೆ, ಅದು ಹೇರ್ ಫಾಲಿಕಲ್ಸ್ ಕಾಣುತ್ತೆ. So you should see that. The question was if someone does eyebrows and come. So you will be seeing hair follicles in that area. So based on that you should take. Now we'll take Karnasya Upari Keshanta Sandhi. So when we see the starting of the Karna, so from there if we go straight, the Keshanta Sandhi. So here here much of the needle will not go inside, only 1/4 will go, that much only you should insert, and then identify the mastoid process, and then half anguli ಕೆಳಗಡೆ on Keshanta Sandhi only. Here half Vrihi will go. Yes. Similarly, only in left. So one year, only once. Don't go for both. Yes. Again, if this tinnitus is due to aghata, Shipra first, then go for that. Don't directly go here. Shikha is usually sir midpoint. ಹೀಗೆ ಹೋಗಿ ಯೂಶುವಲಿ ಕೆಳಗಡೆ ಬರುತ್ತಲ್ಲ, that the midpoint is. So there is an angle, right? Your head goes like this and comes like this. So midpoint on this is Shikha. Bhrumadhya and Kapal. From the angle of your eyebrow. Eyebrow the angle irutte. Eyebrow is not straight. Where the eyebrow bends. So this usually it will be lateral 1/3. So from that point, when you go 45 degrees above on the hairline, that is Kapal. Yes, understood? 45 degrees. Yes, it will go in slant.
Okay, mark ಮಾಡಿ.
ಇಲ್ಲ ಬ್ರಾಡ್ forehead. That is again anatomically when we see. ಅದು ಯೂಶುವಲಿ ಮಾಡೋದಿಲ್ಲ. ಇದು ಹನುಸಂಧಿ ಮಧ್ಯದಲ್ಲಿ ಅದು
Tumba, like there is one more practice where we take Hanusandhi Madhyagatam point, where Apasmara point we see here in TMJ joint, in Karana Rogas also. So when there is usually lot of Kshayaja Samprapti, so you take this. Usually we take that in trigeminal neuralgia, or where there is more of Kshaya and there is a hearing sensation loss. That time we will.
Old age.
Yes, old age as well. We take temporomandibular joint, where it is usually done in apasmara. This is all through practice. The observation is seen.
Yes, sir.
So we'll just mark Kapala. This is a whiteboard mark. Huh? ಇಲ್ಲ. So the thing is, huh?
ಅಲ್ಲ,
Here,
just
mark
ಒಂದ್ಸಲ
ಮಾಡಿ,
identify
ಆಮೇಲೆ.
ಮಾಡಿ.
So
Just marking the point, just see.
this is her angle, eyebrow angle. This. So from here, approximately, don't take protractor and do 40 and 45 degree. So in this point, this is Kapala.
ಅಲ್ಲಿ ಕೇಶಾಂತರ.
Keshanta, where the hairline is there. Yes. Now the doubt comes: what to if the patient is bald? So just see for minute hair follicles if you can see, and do it over there. Yes, that time you can take. You should take Keshanta only. Yes. That's what. How your forehead it is. Same. Usually pitta ಜಾಸ್ತಿ ಇರುವಾಗ ಭ್ರೂ ಮಧ್ಯ. Anytime pitta, if at all. One more thing I would like to deviate from the topic: hypertension. When it is due to pittaja karana, pittaja nidana is more. You do just bhru madhya. Within 10 minutes, the hypertension, the blood pressure will come down. Just bhru madhya. But it should be because of pitta related karana. But usually in any Shirashula cases, these 3 points. Yes, if veins are prominent, do Rakta Mokshan. Veins are prominent, do Rakta Mokshan. Because that will give more relief to the patient. Usually one more Shiraveda they do is from jugular vein for Shirashula. If you are confident enough, you do that. If you are confident enough to put the needle in jugular vein, do it. Yes. Yes, any Ardhava Vedaka Suryavarta, that is the best. Jugular vein. Immediate the pain will come. But confident enough, you should have seen that procedure. You should do it under guidance first and then you can proceed. Because that is more sensitive area. Karna. Huh? Huh? Yes. That we will see later.
Yeah, perfect.
So basically, I have my hearing loss
Sorry.
by that.
That's right.
So, and sometimes changes only when I do Vatakara Nidanas, when I sit under the fan for the 10 minutes, I start getting tinnitus. And that's all. And whenever someone calls on the back, I feel like I don't hear and I don't respond, obviously. And then sometimes whenever there is a long sentence, I feel it is jumbled and I don't understand sometimes. So these are my problems since 12 years. I'm having this.
Okay. So how did it start?
the Nidanas.
Okay.
And when I do Vata Kara Nidanas, only this status gets.
No, no. How did it start? When did you find it first? Like how it exactly started? Was there any history of Jwara or any nothing like
When
that?
I was in around 3 years, I
Hmm.
got viral. I was operated because I don't know that history in the.
Okay.
When I was operated for some viral fever or some lump over my thyroid cancer.
Okay. So when you were about at the age of 3 years.
At the age of 3, but I started experiencing symptoms when I was 17, from 11 years.
Okay. So there was an operation. That one operation only was done in all these years, or any other operation was also done in these things. So Vatakara Nidana. And she's telling there was an operation also because of what? Some Jwara was there.
Viral fever and
Ah.
viral thyroiditis kind, and I was operated.
So there was some lump due to fever. And she was operated
At the age of 3.
at the age of 3. So this might be also the Nidana. I'm not telling this is the Nidana. So Aghata is there. First we will take Shipra and then do Karna. Understood? Shipra everyone knows? Should I repeat? So the Kshipra Marma I am telling about now. Draw a line from Anguli, first Anguli and Angushta. So this exactly where it intersects, that is Kshipra. So when you press this hard, patient will feel pain. You can press your own. You will feel pain. Exactly on the opposite side. So 2 angulas above the Kshipra Marma. Exactly. So here comes the point. Exactly. When you see it in the 3D angle, so consider yourself as a 4-legged animal. So Kshipra is below and 2 angul is above. So that is Dvayangula above Kshipra. So when you press this, she will be feeling pain. So exactly that is the point. Even you press here, you will feel pain. Even you press it here, you will feel pain. So exactly that is the point. And there, Ardhavrihi only should go inside. Ardhavrihi, half of the needle should go inside. Yes?
Sir, if he's feeling the pain at this point, isn't that the Marma spot?
No, no, no. Marma is here. 2 angul is above the marma. They have told. If you refer that shloka, Shushruta Sharira, 8 bar 17, I guess. There they have told in Vatarakta, in Vata Kantaka, Padadaha, Padaharsha, all those things you have to take Shipram, 2 angulis above the Shipram. Do Vedana Karma. So in this area, if there is a Sira see, do Sira Veda. Usually we won't see Sira in this area. Yes? So perpendicularly and make the fingers wide apart, not like this. Make it wide and perpendicularly prick it half free. ಈಗ ಕೂಡ ಇದೆನಾ tinnitus? ಇಲ್ಲನಾ? half free. So this is the starting point of Karna. Karnasya uppari. This.
exactly where the Keshanta Sandhi is there. And downside, Vidura Marma, half anguli below. This. On the Keshanta Sandhi itself. So above, needle will not go that much. How much it goes, you should prick and remove. Below it will go half. Both the ears. ಎರಡು ಕಾಯ್ತೀವಲ್ಲ. Similarly on this side. See the rakta came. Cut. Process ಇದಲ್ಲ ಮಾಸ್ಟರ್ process. Usually ಇಲ್ಲಿ ಇದು ಪ್ರೊಟ್ರೂಷನ್ ಇದರ ಅದು ಕೆಳಗಡೆ ಹಾಫ್ ಅಂಗುಲಿ ಹಾಫ್ ಅಂಗುಲಿ ಅಷ್ಟೇ, ಒಂದು ಅಂಗುಲಿ ಕೂಡ ಇಲ್ಲ, ಹಾಫ್. ಅಂಡರ್ಸ್ಟುಡ್? every sitting. It's like mathematics. How it started, reverse you have to come like that. Like how it started, like there was a aghata, so vata rakta samprapti might have been there. So go for vata rakta samprapti first and then go for that specific organ. One of the case is there with me. He is having one eye complete blindness. He is coming since last 4 months. One eye complete blindness. When I asked him, sir, before it was I was able to see but very blur, but doctors told me to operate it. So after operation, complete eye is blind. So that is aghata over there. Any kind of surgery is aghata. Only if we don't take proper post-op care as per Ayurveda, it won't heal properly. And no one does in current era. Whatever they have told, snehana, svedana, whatever. Internally medicines also they are told balya, sneha dravya should be going inside. But no one does that, frankly speaking. So there is vata rakta samprapti. If you open vata vyadhi nidana in Sushruta, you will see that there are specific karanas, there are specific nidanas, and they have explained how the samprapti is. So first I take Kshipra on that and then do eye related with that. And now his vision is coming from lateral side. I am not giving internal medications also. I want to test how far it will take to gain his vision. Sorry? ಕೈಗೆ ಅಷ್ಟು ಸಾಕು. ಯೂಶುವಲಿ ಏನು ರೂಲ್ ಅಂದರೆ above umbilicus, if there is any vyadhi related to vata rakta, hands. If at all it is all over the body, like visarpa. Sometimes what patient will tell, sir, ನೆನ್ನೆ ಇಲ್ಲಿ ಅಷ್ಟೇ ಒಂದು ಲೀಜನ್ ಇತ್ತು, ಇವತ್ತು ಫುಲ್ ಬಾಡಿಯಲ್ಲಿ ಇದೆ. That is sarpana. Though it is not herpes zoster, but it is sarpana. So quick it has gone all over the body. So take all the 4 Kshipra. Yes. So I take Kshipra of hand and then do Viddha karma of eyes. Now it is around 5 months, 5 to 6 months. He is coming regularly. He is coming. He is taking Viddha and going once a day. He tells now first he was like, I am able to see the light, and if you do like this, there is some shadow moving. Now he is able to see that there is a tree over there and that shadow is visible. It's 5 months only with no internal medicines. So I just wanted to see, and patient is willing. With his permission, I am doing that. So for that is how Viddha works. Though black and white, but he is able to see. Or else he was driving vehicle with one eye only. How dangerous it is. So samprapti matters the most there. So if you keep on doing with the eye there, you will get results, but not perfectly. Understood? There was one kid who was sudden hair loss. When we asked in cousins, there was a fight and one cousin directly slapped on his ear. Sudden hair loss when we were in sir's clinic. Then sir took first with Kshipra and then he went for Karna Vedana. Then we did Karna Purana, everything, all that we did. Thankfully, there was no rupture in tympanic membrane, but hair loss was there. So, based on Samprapti, how it goes, we should take.
Lunch is ready. Before getting cold, we'll have lunch first, then come back and continue with the demos. Okay? And of course, Netra part. Have lunch quickly and come back. Lunch is arranged at ground floor.